Yeah, let's actually go into that a little bit more. Let's dive into what we think are the biggest, maybe one or two main positives and then one or two main negatives, because I think it's pretty individual what especially what the negatives, actually even the positives, would be. Sanjeev, do you want to start us off? A couple of negatives and main positives.
So negatives, I think probably it's I don't think there are some jobs like it, but it takes a significant portion of your life. So you're quite dedicated to work, at least if you're a good doctor. Even the bad doctors are committed to it, and it does take a big proportion of your time. And the way that becomes a negative is that means you do sometimes miss out on things that might be happening in other parts of your life. Like, if you play sports, if you have a long shift and you're meant to get to your game, you can't just talk to the patient you're talking to. You can't just sort of say, "Oh, time out. I've got a hockey game to go to. I'm going to go." You have to sort of finish your work and make sure things are happening for the patients. So that's definitely one of the negatives. I think it does, in a way, steal time from other activities, but that's sort of the nature of the job. And maybe the other negative that comes with that, which I've definitely experienced myself, is that time component does bear on you, and you do get tired. So it's really important to know that it can be, some weeks can be quite tiring, and it's important to be able to recover from that. Positives, there's definitely lots of cool stuff. Meeting a patient that has a problem and then being able to sort it for them. Like the example, maybe for surgery, like a broken bone, fixing that broken bone for them, and the next day they go home and they're absolutely chuffed. They could have ended up having like a deformed arm, and not got it fixed, and that might have impacted them for work, like say a labourer or something like that. Having a broken arm that's not fixed could mean that they can't use their arm again properly. Or someone who's got really bad arthritis that needs a new hip. They've come in walking with crutches, barely able to walk. You put in a new hip, and the next day they're sort of thanking God because now they can go and walk again. They can do long walks on the beach. They can get back to work. They can get back to their life. And I think, those are just like sort of small examples of getting people better. And I'm sure Liz and Justin can talk about lots of different examples they've seen, but I think that's a really privileged position to be in, the fact that you can literally change someone's life like that.
Yeah. Awesome. Yeah. I completely agree with pretty much everything there. And I think I know that obviously, when you're a real junior, that idea that you're actually changing someone's life can be, especially, something like surgery is quite tangible, obviously. And there's a clear difference that's being made. But when you're saving someone's life involves, charting them a laxative to make sure that they don't have so much constipation that, that either their quality of life is affected or they, intestines erupt or whatever, then it's hard to kind of correlate that, because for you, the action is just a scribble on a piece of paper. And so that can be quite disconnecting in a lot of ways. And I think we've talked about this on the podcast as well. We had Art Nahal and Nick Schickett, who run the I Am Reasoning podcast. Some of you may know about that. We were talking about this before, is that it does take a little bit of time to develop the perspective, to reconnect the sense of actually making an impact. And sometimes you might decide that actually that's not the impact that you wanted to make, and that'll be fine as well. There'll be other ways of doing it. But anyway, Liz, positives and negatives for you.
Yeah, so similar to Sanjeev, the negative would be around the impact on personal life. So I have a 2-year-old now, but when I was doing my house officer years, he was just a baby. And doing surgery in particular, I missed out on a lot of time with my family. And he's now very attached to his father. And, that's something that I have to grieve, actually, that I did miss out on that time. And I was trying to still breastfeed, and that didn't happen because I'd say, oh, look, I need some time out to go breastfeed. And they'd say, oh, we've almost finished the round. Can you just wait another 5 minutes? And, then the next patient was actually like a really complex one that took half an hour, and then it just didn't happen. So there was a lot of impact on you personally and physically as well. I think Sanjeev talked about the tiredness. And I know that, I do research into mental health of doctors, and this is something that's real. It takes a huge toll on you psychologically and physically. So that is something that you don't see on Grey's Anatomy.
Oh, yeah.
You don't see on House. Is actually you're just dog tired sometimes. Yeah, and you get a bit cynical about things. Cynicism kicks in. Yeah.
Plus 10 for that cynicism. Anyone that knows me.
Yeah, so that's the negatives, but the positives, like the whole reason I wanted to be a doctor was to be able to help people, and so when you get those moments where you're able to help people, it's really exciting. And like for instance, there was a patient who was on the psych Jerry's ward, so older adults, mental health, and she had some medical things happening. She was having some blood in her urine. And everyone was like, no, she's just got a UTI, treat the UTI. I'm like, no, she doesn't. And so I really pushed, and I was like, no, this needs investigation. Like, if she wasn't so, had severe dementia, what would you do? Oh, we'd do a cystoscopy, would check for things. And I said, okay, well, can you please do that? I'm going to advocate for my patient. And so I actually ended up having to ring the boss, a urologist, say, hey, it's just a first-year house officer here. Can you do this? And he did. And she turned out to have a bladder tumour.
Wow.
So we managed to get her sorted, and then some of her dementia/delirium started to resolve. So, those moments where you really actually push for your patients and try and get a result, even when, a lot of even my consultant, he was like, no, don't worry, but I just keep plugging along. And, making a difference for people is really, really cool.
I think it's important to note that process of, plugging along, you could have been wrong. You could have been wrong.
Could have been nothing.
You could have been wrong. Yeah,
could have been a urine infection.
Yeah, it could have been nothing. But so in this case, the payoff sort of was there. But it's actually quite scary and challenging to be someone that's pushing when the rest of your team is saying like, nah, don't worry about that, because you think like, oh, well, I mean, they're senior to me, or I must be wrong. There is that kind of mentality. So I think a lot of people probably wouldn't appreciate kind of what that feeling would be like to be the person that sort of advocates, and then the outcome is this really awesome, cool sort of thing. But just, think about that, sort of sit on that. I mean, think about people that you wouldn't normally speak out against, like your parents, or I don't know, like your teachers or whatever, and just think like you're consistently pushing and advocating, and it actually has this really good sort of effect. For me, I actually would have to say that it's very, very similar to what you said. It's probably a combination between what you and Sanjeev said. The advocacy part was my most fulfilling thing that I found satisfaction in. The patient education part was the thing that I enjoyed the most. But unfortunately, I had very few real opportunities to do the patient education and advocacy stuff because of the day-to-day work that was required, sort of the daily grind. So I remember a instance where there was a patient, and I think I was working in psychiatry as well, and this person was on an antipsychotic medication, and and a lot of these antipsychotic medications, especially the one they were on, makes them obese. It's incredibly weight gaining for them to be on this medication. So they were really struggling with just that aspect of their life. And so I just gave them some advice on how they could potentially get in better shape and add some kind of sustainable exercise and improve their diet in a way. And just like really simple things that you would expect, like the GP to be able to give lifestyle advice and things on. And they came back 5 weeks later and they said it's the first time in my entire life that they've been able to actually lose weight and not feel super stressed about it. And that's probably one of the highlights of my entire medical time for me. And that moment came for me actually when I was in my 5th year of medical school, not even as a house officer. So for me, the really positive part is the education, being able to actually change someone's behavior. The negative aspect, personally, and I've talked about this on my podcast as well, is really around the fact that I felt that I was unable to control some of the areas of the system that I felt were very inefficient. So I would be trying so hard to do the best for the patient. I really would care despite having sort of compassion fatigue. And I'd want to do something for the patient. And yet at the end of the day, the reason it can't happen is because of some just ridiculous logistical or paperwork or systems issue that makes everything inefficient, or things will move very, very slowly because of these inefficiencies, or there were so many things that I thought we're wasting so much of our energy and effort and like almost like life energy, like the ability to give a shit. That was used up on so much of the system inefficiency for me, and I felt pretty disempowered to make a difference about that. And every time I spoke up about it, I actually had meetings where the managers of units would sit down with me just to tell me that it's my fault. They were like, oh, you're finding it inefficient. Well, maybe you should be more efficient. And it's like, I'm the most freaking efficient person that you've met. And it's like, when they ask you for feedback, I'll give quite like very targeted feedback. And I've been emailed about it. And people have said like, we need to talk to you about your feedback. And when they ask about my feedback, it's not about wanting to know more. It's about trying to sort of protect themselves from it. And that was incredibly sort of felt disempowering for the efficiency side of things. So that was my main positive and negatives. I don't know if you want to add anything, Liz and Sanjeev, about that.
No, but I think we are very privileged. So, why do we work these long hours? Why do we do all this? We're privileged because we are able to help people when they are in acute need. Like, people come to the hospital, this is, scary stuff. You're having a heart attack, you're having a stroke. Like, this is life and death for a lot of people. And to be able to be the person there, to hold their hand, to say, it's okay, this is what we're going to do, this is the plan, communicating, that's such a privilege. And yeah, that's what gets me out of bed at 6 o'clock in the morning to go and do the work, is that people really do appreciate it when you're there for them and you're authentic. Yeah.
But it's not necessarily because it is a virtuistic thing. It doesn't mean necessarily it is for everyone. There will be other ways of impacting. If you're someone that wants to do medicine because you want to help people, there will be other ways that you can help people that could be just as fulfilling, just as impactful in a different style. But it is true that medicine does come with it, bundled, a specific, very unique type of privilege, like what you've just mentioned there. But I don't want anyone to sort of get into the frame of thinking that because it's privileged, therefore I must enjoy that and want that in my life. If you feel like that's not really for you, it doesn't have to be, just because it is inherently, sounds like a good thing. Just want to make that. Sanjeev, did you want to add anything?
Yeah, I guess sort of continuing on from what you were talking about, sort of patient education and advocacy, and then, tying that together with being in that privileged situation. Like, we've trained all this time to learn all this medical information, but the crux of it really does come down to being able to communicate a lot of that stuff. Like, you can, this sound really bad, but you can teach a monkey medicine, actually. You can teach them the actual, like, science. Like, it's not that hard. There's a lot of stuff to remember, for sure. But the hard part is actually being able to, like, communicate that stuff to patients, do the right thing for patients, and do the right thing by them. Because people will find, and it happens in every line of work, things aren't textbook. Not everything is like, oh, exactly like the textbook, this is my answer, because patients have their own lives, they have their own issues going on. So I think, being able to communicate really well with other people and with patients is important. And then, the virtuistic part, there is definitely an important element of that. Like, if you don't feel like you generally care for people, I think medicine's it's going to be a very tough road through medicine, because that's one of the big things that I think drives a lot of doctors. Not saying that it drives all doctors, but definitely a huge proportion of them. The reason they get up out of bed is because, they want to go to work, and they want to make sure these patients can have their medical problems or whatever problems they're having, get them sorted and help them along with their lives.
I think, a question that some people submitted some questions. We're going to get to the questions that you submitted and the ones in the comments real soon. But one of the questions that was submitted was what is a, question that you get asked in an interview, actually, which we're not going to talk about that this time. We'll probably talk about that next week. But one of the the typical questions, which actually, funnily enough, doesn't get asked in the interview anymore, is why do you want to be a doctor? And the common advice that goes around there is, don't just say it's because I want to help people. I mean, that is good advice, but it's not because you shouldn't want to help people. It's just that helping people is almost like a prerequisite for the whole career. Medicine specifically, there should really be something else in it that leans you towards that way, rather than being something else that could also help people. I mean, like if you are a financial advisor and you're helping someone who's like about to lose their house, I mean, I'm sure they're really going to appreciate you, and I'm pretty damn sure that that's going to help. So there are lots of ways to help people, but that just a little point about that.